Michael is busy at work. He works in a pressurized job with many deadlines to be met. Michael develops an uneasy feeling in his chest and cuts short the telephone call he is making. He senses pressure in his chest, with pain radiating down his arm. This has never happened to Michael before, and he is concerned. The pain becomes unbearable, and he collapses. Luckily for Michael, someone has witnessed him collapsing. His work colleague Roisin is a cardiac first responder, and she knows what to do. Responders are often the first on the scene and give valuable care until pre-hospital emergency care practitioners arrive. Roisin has initiated the chain of survival. She has called for help and an AED. Her training enables her to quickly assess that the patient is in cardiac arrest, and she activates the second link in the chain of survival, CPR. Roisin's work colleague arrives with an AED, and she gives him clear instructions to call for an ambulance. While the ambulance is being called, Roisin attaches the AED to the patient and delivers a shock. The third link in the chain of survival has been implemented, all in a matter of a few minutes. CPR must be maintained throughout the episode to ensure oxygen delivery to the brain. Ambulance control takes the details from the caller and enters them into the dispatch computer and dispatches the ambulance. While the ambulance is en route, CPR is still in progress. A second shock is delivered to the patient, just as the paramedics arrive. The paramedics provide the same care to a cardiac arrest victim. They, however, have additional equipment and skills to enhance the process. Verifying that the patient is in cardiac arrest, the paramedics radio for advanced life support backup. When the advanced paramedic arrives, he confers with his colleagues and verifies that the patient is in cardiac arrest. The patient now has the fourth link of the chain of survival available to him. Each member of the team, cardiac first responders, paramedics, and advanced paramedics, all have roles to play in a successful resuscitation. No matter what role or skill level, it is essential to ensure that at all times CPR is being performed. The monitor indicates a normal sinus rhythm, therefore the patient has been successfully defibrillated. This is confirmed by the paramedic by pulse checks. The patient currently is not breathing on his own, therefore he requires to be ventilated, and the advanced paramedic elects to intubate the patient to protect his airway during transportation. Each intervention is checked. The patient is loaded onto the trolley stretcher in a coordinated way, ensuring continued ventilations. For this patient, the chain of survival was intact, and he has an excellent chance of survival. The challenge of dealing with an emergency situation can be overwhelming. As a cardiac first responder, you will be trained to take the appropriate action, thus adding calm to the situation.